Hello po and magandang hapon. I'm sorry for our delay today, but there are technical difficulties po that we are encountering with regards po sa ating internet. But today is a Tuesday after Valentine's Day po, and we are going to combine two features of our show that we normally do. The first po is the medical word of the day, and we are now up to letter F. So, ang napili po natin is fever. And we will do this po in a Q&A format or the Ask Dr. Anna format. So my name po is Dr. Anna York Bondok. Our program po is called Libreng Konsulta, and ang purpose po natin dito ay para po mailapit at maging makabuluhan and madaling maintindihan po ang medical and health and scientific knowledge po tungkol sa ating pong katawan, tungkol po sa ating kalusugan para po sa madlang tao. So I hope that I could be able to impart medical knowledge in an easily understandable manner. So my name, Dr. Anna York Bondok. The program, Libreng Konsulta. Please follow us on YouTube. We are trying to reach 1,000 subscribers. Our YouTube name is, again, Dr. Anna York Bondok. Sorry. And please put your questions below po kasi Q&A format po tayo for today. And our topic will be fever or yung tinatawag po nating lagnat. Okay? So, Miss Reina, I hope that, and Miss Kat, thank you for joining us today as our moderators. I understand na medyo mahina po ang internet ni Miss Reina, our registered nurse. So, Miss Kat, are you ready to upload the pictures, including the picture of the security guard?
Yes po. Wait lang po.
Ayan. Okay, good. So, sige, I'll just tell you lang. Ready na. Okay? I'll tell you po when to upload. Sige, trial lang po tayo as this is live talaga. And thanks for joining us today. So, ganda po ng topic natin, fever. It's related to COVID. It's also not related to COVID. Hindi po lahat ng lagnat ay COVID. So, let's start. And magandang hapon po sa inyong lahat. So, bumati po muna tayo and then let's do a few questions. Okay? Please put your questions po below about fever, lagnat, COVID, or hindi po COVID. Willing po tayong sagutin. Okay? So, Miss Kat, sorry. Mahina po ang mata ng inyo pong doktora. Maybe I need an eye checkup. Okay? So, please.
Okay. From Miss Ruby Arce. Good afternoon po, Doktora.
Hi, Ruby. Magandang hapon po.
From Miss Felicidad Concepcion. Good afternoon po, Doktora Ana.
Hi, Ma'am Vice, and I hope that you are well.
From Miss Erna Lorca Exmundo. Good afternoon po, Doc Ana.
Hi, Ma'am Erna. Magandang hapon po.
From Miss Juvie Sibug. Good morning po, watching from London. Maybe it's morning in London, kaya morning po yung nasabi niya.
Kaya morning siya. Alam mo, Miss Kat and Miss Reina, at sa lahat po na nanonood, first time po actually na magkaroon po tayo ng from London. I don't know, baka naman meron, di lang bumabate. Pero this is really the first time. Kasi I've had greetings from Korea, Japan, sa mga UAE, Jeddah, Milan, LA. First time po from London. Miss Juvie, tell us more about yourself. Are you a nurse? Thank you for greeting us. At very nice question. Ano po ang temperature po sa London ngayong umaga? I understand this, it's very cold. So, yun po. Sige, Ma'am Juvie. Thank you for greeting us.
Oh, I think
From Miss Ray Yumang, mayapa oras, Doktora Ana.
Si Sir Ray should actually be my co-presenter here, okay? Kumpare ko po yan. A long-term educator and a broadcast communicator po. He's one of the best persons to interview anyone in Pampanga, and it's a huge honor to have him. Sir, mag-co-host tayo.
From Miss Viron S. Carlos, good afternoon, Doktora.
Hi, Viron. How are you? Opo. Maybe we can tackle the first question.
from one of our viewers, paano po nababasa ang lagnat sa wrist o noo, yung ginagawa po ng mga security guard?
Nako, ang ganda naman ng tanong. Bumira ka agad. Fabulous question. Let me put it this way. One of the reasons why I chose fever po is because everybody, naka-encounter na ho na sikyo sa mall, sa bangko, anywhere that you go po, trabaho po ng security guard ngayon, hindi na po magbantay ng magnanakaw. Ang trabaho na po ng security guard natin, he is now a frontliner. This is not a joke, ha? Much respect po to security guards because tinanggap po nila itong mahirap na trabaho to. It's not a joke na makaharap po. I mean, right there and then po, yung possible na may COVID, we don't know. And they were really not trained naman po. I don't know if there's a temperature training. Meron ba? For security guards. But this is not their training po. But due to the pandemic, wala na po tayong choice. And we have appointed po the security guards to be the ones to take our temperatures. So, normally, this is the job of a nurse. Ikaw ba, Reyna, di ba? As a nurse, one of your trainings is to take temperature. Tama ba ako?
Yes po. Opo. One of our
Yes.
job is
And it's,
temperature.
yes, and it's one of the first things that anyone does when they enter the ER, the clinic, or even the ward or the floor. Tama ba ako, Reyna?
Yes po, Doc. Baseline po.
Oo, height, weight, and temperature. Hindi ba yun ang tinatanong?
Yes po. We call it baseline data, Doc. Subjective to the patient themselves po.
Yon. So, yon. So, actually, that's why I chose fever. Kasi lahat po tayo ngayon ay kinukuhanan na po ng temperatura or sometimes binabaril is actually the term in Tagalog. Barilin mo nga yung temperature niyan, di ba? You've heard it or kunan mo po yung temperature. Can we see the picture po of the guard taking the temperature? Ayan. And then, yung mga pictures po na pina-upload ko po, and I'll talk about each picture as it comes up. Ayan po, no? Very common po ngayon. There's like it's like a gun. And tinututok po talaga dito po sa noo, no? And then babalik ta rin po ni Kuya, papakita niya po na 36.5, 37, ganun po. And then isusulat niyo po 'yon sa health declaration form. Okay? So I will go later on. Ngayon ko rin ho, I was also quite curious about this process. So next picture, please. Ayan, hintayin po natin, ano? Ayan, sa mga kids po, as you can see it a little more clearly here, hindi naman mukhang baril to. Kasi ewan ko ba, baka yung binibigay sa security guard para naman ho medyo pang sikyo. Looks like a gun. So next picture po. Ito po ba yung pagbukas ng zip file? I don't know. Opo. So, while we're waiting, I'll just go into a short history po, no? Yung temperature po talaga, bubuka na kaya yan? Anyway, what is the normal temperature? I guess that's a good question po to ask, ano? Because it's so common. We do it every day na ngayon due to the pandemic. And magugulat po kayo that there's actually no standard normal temperature. Sa sa mga tao, they normally say 37 degrees centigrade po is the normal temperature. But, nagva-vary po yan based on what you're doing. If you're exercising, if you're sweating, if you're taking a bath, it also varies po depending on where you are. Are you in an aircon room? Are you under the sun? Kayo po ba ay nasa loob ng isang mainit na bus? And then it also varies po according to the time of the day. Sa umaga po, pinakamababa po ang ating temperature. And during the day po, our temperature increases. And pinakamataas po nating temperature is around early evening po at maghapon. So, sinasabi po nila that the normal temperature is 37 degrees, okay? Pero, pwede po siyang mag-vary between 1 to 2, pwede na between 0.5 to 1 degrees centigrade up or above is actually still normal. And sinasabi po nating may lagnat, people sometimes say 38 degrees centigrade sa ano po, in the hospital po, what we normally really consider a fever and what would trigger po a fever workup is 38.5 degrees. And then, so yun po yun po. People say may lagnat. Sa Tagalog po, sinasabi nilang may sinat. So usually, ang meaning po ng may sinat is a little above 37 degrees. So siguro po, ang pag-usapan po natin is how to take one's temperature, no? Yung una po, nung unang panahon, or when I started, nung unang panahon, at yung mga may kaedad ko po, they remember, the most common po, way to take temperature before was yung, ano po, the glass thermometer. I think I have a picture of the glass thermometer, if you don't mind to show it kung kaya lang po, ano? And then, ang nakalagay po doon, inside, there was like this red thing po, and then umaakyat po yun, and then, when you get it, nakikita nyo po, ginaganon-ganon po ng mga nurse. They bring the temperature down to, ano po, ayan, nakikita ba? Ayan, sorry, it's a little small, but there's a red po. That red is normally mercury. So, pinapababa po nila yon. That's why we shake it. And then, we put it either under the tongue, sa kilikili po, for the children, rectally, sa puwet. And then, as the tumataas po yung temperature, nag-expand po yung yung mercury, and then it goes up, corresponding po dun sa temperature po ng tao. So yun po yung traditional or old style po na temperature. Ayan, nakikita po. Thank you for enlarging it. Ayan, that red stuff, no? I just have this story to say. One time po, when we were in the ER, have you ever broken a mercury thermometer? Meron bang situation? Ikaw, Reyna, may nakita ka namang nabasag na glass thermometer nung panahon nyo?
Nakakabasag po talaga ako lagi.
Yes, okay. Sometimes we notice that the red dot bounces. That is
Yes
the
po.
mercury po. Yes, opo.
Yes.
Pero, yun nga, it's supposed to be toxic eh. And we are advised not to use it anymore. And nag-develop na po sila ng newer forms of getting temperature. So ngayon po, we use the contact temperature and the non-contact way of getting temperature. Yung contact po, yun po yung mga, the ones they put under the tongue, the ones they put sa kilikili. Siya, nagsiscan na siya. It's now a scanner. And they use infrared technology. And for the non-contact, ginagamit, ito po yung tinatapat po sa noo, sometimes sa tenga, the tympanic membrane, or ngayon po, in our wrist. So, ang sa noo po, they read pala the temporal artery temperature, or the temperature through infrared technology po of our temporal artery, trans here until here eh. And then, may artery din po dito, that's the one that gives us the pulse. Yun po yung ating, pwede rin po dito, brachial artery. And then, yung sa ear po, they read the tympanic membrane temperature. Okay? So, reportedly po, more accurate po yung wrist. But, yung temporal artery po, itong binabaril ng guard, can be affected po by smoking, kung may makeup po kayo, kung kalalabas nyo lang ho sa sasakyan na malamig, kung nag-public po kayo at mainit, and if you're sweating. So actually, the purpose po of the guard is just to find out kung mas mataas po kayo sa 38, di na ho kayo makakapasok sa mall. So, yun po yun. It's really not that accurate. So one of the things that I wanted to know po is, diba, you enter multiple, masama ba yun? Reportedly, hindi naman daw po masama yung infrared. Kasi there are now studies and concerns that people are being subjected to this infrared technology. Right now po, yung screening of the temporal artery is already the standard po sa ibang hospitals. The proper technique po, yung iba po dito some people slide it pa to the back of the ear. And then, again, as I mentioned, it's subject to a lot po of things that could make your temperature higher or lower. So, sa kids, the most accurate, sabi po nila, is rectal temperature. Sa adults naman po, it's supposed to be oral temperature per contact. Yung thermal scanning, it's okay naman po yung temporal artery scanning. Sabi nila, the wrist is more accurate. A funny story po about yung ear temperature scanning. Kasi I was an intern po sa PGH Pedia. And every hour po, we are required to take the temperature po of certain kids, yung talagang grabe, yung mga hindi masyadong grabe, every 4 hours. So, yun po yun. We have to keep taking the temperature of every child. Almost 30 po yun. Every hour yung mga iba at every 4 hours yung iba. So, during my internship, so nakakapagod ho siya talaga kasi we have to keep putting it dun sa kilikili ng bata or under the mouth and tell the mom to watch it po. And then call us pag mga 1 minute na. So, one of my birthdays, my tita gave me one of the earliest po, it's a tympanic ear scanner. So, we were so excited po bilang interns. Lahat po ng bata, iskinan po namin yung tenga. So, 30 yon every hour. You can just imagine what happened. In one day, nasira po yung imported scanner na binigay ho ng tita ko. So, moral of the story talaga, yung mga old temperatures or yung mga glass thermometers, talagang maraming nababasag doon, but they are really quite heavy duty. But they are no longer used today because of concerns about mercury. Yung mga thermal scanners po, ear scanners, kuminsan yung quality po varies. So, yun lang po. And thanks. So, now we know what the guard is doing. O, ikaw, Reyna.
Very high-tech na, Doktora, yung tympanic. Sobra. Nakakatuwa.
Hindi, pero nasira rin siya. Oo. Nasira siya kasi hindi niya nakayanan si Philippine General Hospital. Okay? Hindi niya nakayanan yung Pedia Ward, Ward 9 and 11 yon ng Philippine General Hospital. Bumigay yung tympanic membrane scanning. So, yun. So, now we know what the guard is doing. He is scanning our temporal artery. Okay?
Yes po. From one of our viewers, ang 37.5 po ba ay lagnat?
That's a good question. Ano ba? Kasi some people are panicking kasi they heard that 37 is the normal. Kung 37.5 ba, lagnat na ba yon? Well, as I mentioned to you po, our temperature varies throughout the day and depending po what we are doing. What I would say is, kung consistently po, mataas, meaning ko ng mataas is usually 38. Pag talaga hong consistently 38 po siya, without gamots, then you have a fever. If in the, eto pa, in the this is even very interesting for those who are doctors or midwives or whatever. Pag nabigyan na po ng Tylenol or paracetamol yung tao, and then nakuhanan mo ng temperature, 38, after 4 hours, ang meaning nun, mas mataas pa sa 38 yung lagnat ng taong yun. It is just 38 because of the paracetamol. But 37.5 po without gamot is not that high. And I would just repeat it po and try to see rin po, galing ho ba kayo sa labas ng bahay? How do you feel? Ganun po. Before I would declare myself with fever.
From Miss Juvie Sibug, I'm always watching po.
Wow, Ma'am Juvie, how are you? I'm glad to know that you are always watching us from London. Opo.
And it's rainy
And
po here in
parang
London. Rainy.
Oo nga,
Maulan.
parang nagre-rain ata sa London talaga, maulan, ano? Oo. Okay, thanks, Ma'am Juvie.
From Miss Lizelle Villeta, good afternoon po, Doktora, from Tandang Sora, Quezon City.
Hi, Lizelle, and thank you for watching us from Tangdang Sora.
From Miss Maricel Gadi, good afternoon po, Doktora.
Maricel, how are you?
From Mr. John Michael David, good afternoon po, Doktora. Ana, keep safe always po.
John Michael, thank you so much. Ikaw din.
From one of our viewers, what's the most common cause of fevers adults?
Okay. Bakit nga ba nagkakalagnat ang mga tao? The most common cause of fever is in any person, adult or child, is an infection. Okay? Ba't nga ba nagkakalagnat ang mga tao? Nagkakalagnat po ang mga tao as a sign na may nangyayari pong kakaiba sa katawan. Okay? People have fevers. The fever is not the sakit. Okay? The fever is a sign na meron pong nangyayari sa katawan nyo. It could be an infection. Ano po yung mga infection na possible? Well, the most common really sa adults, I would say, is a bacterial infection. Sa kids, I would say more of viral eh. Kasi mas viral talaga yung mga bata. Pero sa mga adults, usually bacterial talaga yan. Kasi bacterial talaga ang mga adults. And then, so viral sa kids, bacterial po sa adults. Other infections po na pwede po is fungal. I have seen fungal fevers sa mga may chemotherapy. Ang TB po is very notorious for causing what we call po low-grade fevers. Okay? Pwede rin po ang viral sa adults. Let's include their dengue. Ang dengue po talaga, pwede pong, in fact, it's called dengue hemorrhagic fever because it's really notorious for having fever. Okay? Ang mga cancers po, like the blood cancers, lymphomas, and leukemias, can cause fever. So, ang fever po, don't panic, but it can be as, like, for example, fever of unknown origin, ang tagal na ho, lingguhan na, iimbestigahin po talaga kayo for cancer doon. Certain drugs that you can take, sometimes penicillin can cause fever. Meron pong mga ibang mga gamot like mga Haldol for antipsychotics, they can cause fever. So pwede po siyang drug-induced. We used to have po antifungals na nagbibigay po ng fever and chills habang binibigay. So meron din pong ganon. Parasites, if you have a lot of parasites, bulate, what's parasites? Bulate, okay, can give fever. And sa mga, those who undergo general anesthesia can also po undergo fever. So, yun po yun. And also, those who undergo procedures, like for example, magpapaano po kayo, Foley cath can Foley catheter can scatter bacteria and cause a transient fever. Ang putting catheters, ports, ganun po, can cause very short bursts of fever. So, yun po yun. Most common cause of fever, infection. So, ang fever po, hindi siya sakit. Siya po ay isang sign na may nangyayari po sa katawan ng tao. Okay?
From one of our viewers, bakit po binibigyan ng paracetamol ang may lagnat?
This is a very good question again. Okay? And why do we give paracetamol po? I have been giving paracetamol for the last 25 years, okay? And classically po, kung meron hong lagnat ang isang tao, we would normally give paracetamol po as the first, parang bumaba po yung lagnat ng tao. And it has a central analgesic effect. Kasi po, most of our fevers, our fever comes from the hypothalamus. Somewhere in our brain po, nagre-reset po siya due to what we call, pyrogens or substances like infections, ganun po, na naproproduce po ng katawan that would reset po the hypothalamus in your brain. So magkakaroon po kayo ng, may iba ho yung temperature point, tataas po yon. And paracetamol, I was classically taught po na it was through the prostaglandin inhibitors po that paracetamol lowers temperature. But reading the more latest researchers po, the paracetamol has been around since, I don't know, older than me, definitely. 1950s pa raw ho. people don't really understand pa rin ho the one and the complete and completely accepted pathway. So marami pong pathways why paracetamol can bring down fevers. Paracetamol is used more than aspirin in children kasi po aspirin was associated with an inflammation, rare inflammation po of the brain and the liver called Reye's syndrome. So sa mga bata po, they really use paracetamol. Sa mga adults po, people sometimes you give NSAIDs, yung mga ibuprofen, Motrin, nakakababa rin po yun ng lagnat. Also aspirin, but again, the most commonly used is paracetamol. Okay, so the known brands. I don't normally like to mention brands. People sometimes say Tylenol and other po na brands po. The generic name is paracetamol. Okay.
From Miss Ana Maria Espinosa, Santiago. Hi po, Doc.
Hi, Ma'am Ana Marie.
From one of our viewer, ano po ang blood culture o fever workup?
Eto, Reina. Have you ever done a fever workup? Do you remember?
Parang hindi na, doktore. Pero na blood culture, yes.
Pero narinig mo na yan. Okay, so sige. Okay, I'll explain that, okay? And I think I read something question about X-ray also. Parang may tanong ata dyan about X-ray. Tama ba ako? Okay. So, iisahin na lang po natin yung sagot. O sige, pakibasa lang, Miss Reina.
From one of our viewer, bakit na X-ray ang mga nilalagnat?
Yan. Magkasama po iyang tanong na yan. Between the blood culture. What's a blood culture? And okay. Once you, let's give a patient, 65-year-old male diabetic, goes to the ER with temperature of 38.5 and fever and chills. Usually, fever and chills magkasama yan. And that's a good sign of infection. So what are we going to do next? Okay. So when the person is in the ER with fever and chills, the first thing that you're supposed to do is a history and PE. And two of the most common causes po sa older adults of fever is pneumonia or UTI. Yun lang po talaga. Okay? So, tatanungin po natin, history, nuubo ba kayo, nanghihina, how are you eating? And then, tatanungin po natin, masakit ho bang umihi? Okay. So, yun po yung dalawang standard questions kasi the most common is pneumonia, community-acquired, and urinary tract infection or yung tinatawag po nating UTI. Okay? So what will the doctor do? So the first thing that you do in a fever workup is alamin mo muna ano ba yung CBC ng tao. Okay? Tayo nagpa-CBC. I did a CBC talk. No? Ano yung points po ng CBC na gusto nating malaman? Okay? First of all, sandali before you do the CBC, alamin mo muna ano ba yung temperature ng tao as he enters habang that's the baseline temperature na sinasabi po ng ating nurse, si Miss Reina. So before the CBC, alamin mo muna may temperature po ba yung taong pumasok sa inyong ER. Okay, let's say nabasa mo 37. So ang tanong ko sa iyo, sisigawan nyo ba? Tatang, wala ka naman lagnat 37 ito. Are you gonna do that? No, you're not gonna do that, okay? Kasi, further investigation. Anong oras po kayo nagkalagnat? Like, today, tuloy-tuloy po ba? Second question, super important, is uminom ho ba kayo ng paracetamol? And third question is, anong oras po kayo uminom ng paracetamol? Kasi kung uminom po yung pasyente ng paracetamol, maybe 3 hours before going to the ER, and he told you na 3 hours ago he was feeling, nakuha siya na 38.5. By the time he gets to the ER po, normal na po yan. So don't shout at the patient. Okay? But it is very important also to document po kung ano ba talaga yung fever. Kasi some people feel hot, pero hindi naman po talaga. Okay, let's just say, naging 38.5 nga siya sa ER. So anong gagawin mo ngayon? The next is CBC. Ano po sa CBC ang aalamin nyo, yun po yung ating white blood cell count. Mataas po ba siya o hindi? The most common po sa infection, mataas. Kung hindi po siya mataas, it doesn't mean na walang infection. It means tingnan mong mabuti yung pasyente. If the patient looks super toxic at mababa po yung kanyang CBC, then problema. Mas problema pa po yun. In fact, I would prefer a higher CBC if you ask me. Okay? So after that, anong next na gagawin nyo? The next thing the doctor will do is to order a chest x-ray po. Kasi kailangan po nating malaman kung may pulmonyak po kayo. And the most common way to do that is the chest x-ray. Number 2 po is the urinalysis. Kung makaihi po kayo, we would like to see your urinalysis and your urine culture. Ano po yung urinalysis? Doon po natin titingnan yung inihi nyo kung may white blood cells po doon sa inyong inihi. Kung what is the urine culture? Kung sa tingin po namin that you have a UTI, we will try to culture. What is the meaning of culture? Culture po is to grow the bacteria that we are suspecting. Bakit po tayo nag-grow ng bacteria? Kasi aside from that, it's called a culture and sensitivity report. Okay? So we need to know kung ano pong bacteria ang nasa katawan nyo. And number 2 question that we need to know is kung anong antibiotic po, sensitive po yung inyong bacteria. Kasi po, there are many bacteria now that used to be sensitive po to many gamots, but now, because of overuse po na antibiotics, parang COVID lang ho yan, nag-mutate na siya at hindi na po siya tinatablan ng regular antibiotics. Okay? Some people do a gram stain, which tells us whether gram-negative or gram-positive po yung bacteria. Pero most of the time, diretso na po to urinalysis and urine CS or urine culture and sensitivity. Ngayon, kung talagang mataas talaga, 38.5, then we will order what we call a blood CS. Why do we do a blood CS? Kasi po, we are very worried about what we call po sepsis. What's the meaning of sepsis? Nasa dugo na po. Aside from going to your lungs, aside from going sa ihi nyo, pwede pong nasa dugo na yon, and that is a very serious infection. If the bacteria is already growing in your blood, hindi na po maganda yan. So that's called a blood CS and blood culture and sensitivity report. So yun po yung fever workup. Ngayon, depending ho on what you look like, for example po, meron po kayong you're developing a severe headache po, you are disoriented, they may consider po culturing other parts po of the body, of other fluids like for meningitis po, yung CSF or cerebrospinal fluid. Yun po yung tinuturok sa likod. Then titingnan din po nila, do you have a catheter? Then possible, dun po talaga leading to UTI. At iba't iba po, depending po on your history and PE. Okay? So yun po yung fever workup. And why do we do the fever workup? So we know po what infection could be possibly causing your fever. Okay?
From one of our viewers, bakit po dengue hemorrhagic fever ang buong pangalan ng dengue?
Well, yeah, that's really the old name or maybe the complete name. Kasi po, dengue is also very well known for, di ba yung low platelets, kaya hemorrhagic, no? Pagdudugo yun, and dumudugo yung mga gilagid ng mga tao. Ang fever po sa dengue, it's also one of these diseases that are known po and marked for fever. And so, sa dengue po, the incubation po is 4 to 10 days pagkatapos po kayong kinagat ng lamok, and then it is marked po by high-grade fever. So, for example, let's just say walang dengue testing, okay? Kung kayo po are living in a dengue-infested area like the Philippines, normal po yung chest x-ray nyo, wala pong makita sa ihi nyo, and you still persist to have then you need a dengue test kasi po mataas po talaga yung probability na kayo po ay may dengue. Okay?
From one of our viewers, most common cause of fever sa bata.
The most common cause of fever sa bata is usually viral. I'm not a pediatrician, so do not write this in stone. Pero ang alam ko po sa mga kids talaga, marami po talagang may viral infections. Ikaw, Reyna, as the mom of kids.
Yeah, viral talaga, doktora, ang most common, no? tsaka yung ano, yung mga sore throat and bacterial infection. Yun.
Yes. Okay. When should you bring a person to the ER? Ako, with fever. Um, pag talaga you have to look at kung ano yung itsura po ng pasyente. If the patient really does not look good po, nahirapan huminga, hindi na po bumabangon, not eating, you need to contact the doctor po. I would call it, sa mga panahon na to, I wouldn't rush to the ER kaagad, no? Unless talagang hindi na nakakakilala yung tao, then talagang baka meningitis na yan, or sepsis. I would try to call the doctor first kung may doctor po kayo. And ngayon, sa mga panahon ngayon po, if you have a fever and you go to the ER, you will be swabbed.
From Mr. Bebot Ranjo, watching from Nueva Ecija.
Bebot, how are you po? At saan po kayo sa Nueva Ecija? Kasi katabi po namin ang Gapan.
From one of our viewers, lahat ba ng lagnat ay posibleng COVID? How do we know?
Ay, ang ganda-ganda po ng tanong na to, no? And, eto lang Reina, this is so sad. But, we have had people na namatay because they were so scared to go to the ER. Kasi either mahahawa sila ng COVID or makachichismis na may COVID sila. Yun pala, they didn't have COVID and they had infections that could have been treated with antibiotics lang at hindi pa sila patay. Okay? So, I would like to stress this. Hindi po lahat, though fever is a sign of COVID, and kung nawawala na po kayo ng panlasa at saka pangamoy, may COVID yung kapatid nyo at may fever kayo at kasama nyo yung kapatid nyo sa bahay, likely po COVID yun, But, fever has existed long before there was ever COVID, okay? 2019 lang, late 2019 lang po ang COVID. So what I'm trying to say is, there are many reasons po for fever. Majority of them can be cured with antibiotics po and proper care. But, if we do not treat community-acquired pneumonia, lalabas po yan na sepsis. Especially po if you have, diabetes or other reasons po na may edad na po, other reasons for you to be immunocompromised, pwede po kayong mamatay if you do not go to seek treatment, whether go to the ER or call the doctor. Kasi po, ang UTI, pag biniru-biru po at pinabayaan, pwede rin maging pyelonephritis or paakyat po yung infection towards the kidney. A UTI can also go to the blood. So, eto po if you really feel bad, kung talaga mataas po yung lagnat nyo ilang araw na, hindi na po kayo kumakain, hindi na po kayo nakakabangon sa kama, you're finding it very difficult na po, you need to call your doctor. Okay? Do not try to self-medicate yourself at home with paracetamol kasi the fever po is not the sickness. The fever is only a sign that you have a sickness. At saka isa pa, hindi po magme-melt ang inyong utak sa fever. People often think of that.
From one of our viewers, ano po fever of origin?
Siguro, ang meaning niya nito is the fever of unknown origin or FUO. That's a form po of fever na hindi po natin alam kung saan nanggaling. For example, may pasyente po dumating sa ER again. Sabihin po natin, 34-year-old female. Naglalagnat po. Sometimes the fever of unknown origin is not 39 pwedeng 37, ganun po, no? Pero persistent, mataas po talaga, like 38, ganun po yun. We need to, we cannot ignore that. And the chest x-ray is normal. The WBC count, slightly abnormal. The urinalysis, malinis. The blood CS, negative. The dengue test, negative. The typhoid test, negative. In cases of this po, 34-year-old female, I'd look po into lymphoma. I might do an entire body CT scan. Number 2 po, I might also look for yung mga lupus po and arthritis and inflammatory diseases. They can also cause low-grade fever. And the third most important point po sa mga Pilipino, low-grade fever pumapayat, think TB.
Our next um, our next question from one of our viewer, nakakahawa po ba ang lagnat?
Okay to nakakahawa po ba ang lagnat? Well, kung yung may lagnat ay may COVID at kasama mo sa bahay, my answer would be yes, nakakahawa yung lagnat. But I would like to stress po that it's not the lagnat itself na nakakahawa, but it is the disease that is causing the lagnat na pwede pong nakakahawa. Community-acquired pneumonia, in general naman ho, hindi naman ho kayo talaga mahahawa ng pulmonya. Unless, kasi I entered so many rooms with pneumonia, hindi naman ho ako na pulmonya, no? Dengue, pag marami hong lamok in your area, you can get dengue at yung kapatid nyo can get dengue. But technically, hindi naman ho kayo nagkahawaan. Nakagat po kayong dalawa ng lamok. And there have been numerous cases po of dengue, multiple persons with dengue in one household. O, di ba, Reyna, narinig mo na yun, 3 sa kapitbahay nyo nagka-dengue, so they're cleaning the barangay, ganon. It's not
Yes.
naghawaan po sila, yes. The environment po of your barangay, of your village, of your neighbor, marami ho sigurong tubig doon, and then the mosquitoes grew there, and then they bit people, and that's why multiple people got dengue. Hindi naman ho nagkahawaan sila. But yes, it is, and if it's, for example, cancer is the cause of the fever, okay? If TB is the cause of fever at umuubo, nakakahawa yun, okay? In fact, if you ask me, I'm more scared of TB than COVID. And of course, if COVID is the reason, then, well, nakakahawa yun.
From Miss Jubilin Kenano Salcedo, ano po pwedeng remedy kapag feeling mo mabigat ang likod, lalo na sa tapat ng baga, wala pong fever, ubo at sipon? Let's just wait for Doctora. She's having an internet problem po or technical problem.
Step.
Hello po, Doktora.